Here's a complete and detailed explanation of myringotomy tube, also called tympanostomy tube, grommet, ventilation tube, ear tube, including definition, types, parts, uses, precautions, and how to use. Definition. A myringotomy tube is a small, hollow cylindrical medical device surgically inserted into the tympanic membrane, eardrum, to ventilate the middle ear and prevent the accumulation of fluid, infection, or negative pressure. It is commonly placed during myringotomy surgery, a small incision in the eardrum. Purpose: to equalize pressure between the middle ear and external ear canal, allowing normal hearing and reducing recurrent infections. Types of myringotomy tubes. Myringotomy tubes are classified based on design, shape, and duration of stay. 1. Short-term tubes. Stay 6 to 12 months, often fall out on their own. Grommet tubes, small, disc-shaped. Shepherd tubes, short flange design, Armstrong tubes, beveled edges for stability. 2. Long-term tubes, stay 1 to 3 years or longer, may require surgical removal. T-tubes, shaped like the letter T, longer retention time. Paparella tubes, double-flanged, longer duration. Good T-tubes, silicone or fluoroplastic, large lumen. Material-based types, silicone tubes, flexible, biocompatible. Fluoroplastic tubes, rigid, longer lasting. Titanium or stainless steel tubes, durable, less common. Parts of a myringotomy tube. A typical myringotomy tube has 2 main parts. 1. Inner flange, medial side, sits inside the middle ear, prevents tube extrusion. 2. Outer flange, lateral side, sits in the ear canal, prevents tube displacement. 3. Lumen, hollow center, allows air passage and drainage of middle ear fluid. Uses of myringotomy tube. Myringotomy tubes are used to manage middle ear problems, mainly in children, but also in adults. Chronic otitis media with effusion OME, fluid in the middle ear lasting 3 months. Recurrent acute otitis media AOM, 3 infections in 6 months or 4 in 1 year. Eustachian tube dysfunction, poor ventilation of middle ear, hearing loss due to fluid buildup, barotrauma prevention in diverse or frequent flyers, facilitation of medication delivery, topical antibiotics into middle ear. When using or caring for a myringotomy tube, avoid water entry into the ear, no swimming, diving without ear protection. Do not insert objects, cotton buds, earplugs, into the ear canal. Monitor for ear discharge, otorrhea, which may indicate infection. Regular ENT follow-ups to check tube position and patency. Avoid forceful nose blowing, which can dislodge the tube. Allergic reactions to tube material are rare but possible. How to use procedure steps. Myringotomy with tube insertion, usually under general anesthesia in children, local in adults. 1. Preparation. Patient position supine, head turned to the side. Ear canal cleaned under microscope. 2. Myringotomy. A small incision is made in the tympanic membrane, antero-inferior quadrant. Any fluid, serous or purulent, is suctioned out. 3. Tube insertion. A myringotomy tube is inserted into the incision using fine alligator forceps. Inner flange placed inside middle ear, outer flange outside. Tube ensures continuous ventilation and drainage. 4. Post-procedure care. Ear drops, antibiotic, steroid, may be prescribed. Discharge instructions, ear protection, follow-up visits. 5. Tube removal if required. Short-term tubes fall out on their own as the eardrum heals. Long-term tubes may need ENT removal under microscopy. In summary, a myringotomy tube is a tiny ventilating device inserted into the eardrum to manage middle ear fluid, infections, and pressure issues. They come in short-term and long-term types, have inner and outer flanges with a lumen, and are mainly used for chronic otitis media and eustachian tube dysfunction. Proper precautions and follow-up care ensure effectiveness and prevent complications. Thank you. Have a nice day.